Good day, Ross Jason Bohemly. Invega Sustenna. It's not a sex change drug. It's not for sexual predators. Schizophrenic or bipolar is not the definition of somebody who's natural, enjoys life, likes health and fitness, to assault them and harm them. It doesn't say that by the definition of bipolar and schizophrenic. It reduces testosterone, makes you into a zombie, makes you obese, lazy, and incoherent, makes you talk funny because you have to think a little bit stronger, and so forth. It takes your human rights and freedoms away, your charter of human rights and freedom, and makes you not want to trust the doctors, because under ethics, they're supposed to help you and heal you, not harm your way of a natural state of mind. It's a human right violation. If you look under the cchr.org and under their mental health and human rights, you can find that. Your doctor's not supposed to mislead you in any way. They're not a military or police force assaulting you and killing you in a wartime act, or else they'd be tried under military tribunals and courts, not a civic law like a police officer or any civilian. It goes straight to a military tribunal when it's a chemical weapon to harm you. Invega Sustenna is under Abilify, Risperidone, Experin, Paraperidone, and about 6 other names. It, like I say later on or before this, it is a pill you take 10 milligrams per day, or a shot once a month that varies from 25 milligrams to 156, and every 3 months up to 500 milligrams every 3 months. That just is in your body. It's only harming you, killing your life. It's a testosterone prohibitor, which makes people into a transgender afterwards, and your whole body dies, just like having AIDS. You can't function in society. It increases your suicide level and death rate because of obesity. If you take CPR at the Canadian Heart Foundation or Royal Red Cross or Royal Life Saving, obesity leads to heart attacks and increases by your weight size of your body and your unhealthiness as well. I don't know I have anything good to say about any psychiatric drugs other than they harm you. They shouldn't be on the market. It's a lethal weapon and a capital punishment in my head. And in Canada, where I reside, it is illegal to dish out an unfair detainment and capital punishment in our country, which it does. I've been detained in this room and in life of lack of health and fitness since 2012 with Abilify and Invega in 2013, forced to take, no consent forms, no forms written out that this is the harm it's going to do to your body, and any family history of the Privacy Act that they can't ask you or get that information from any other doctor either. Don't ever take any psychiatric drug. It's a definition of genocide by the United Nations and a human rights violation to harm life and kill your life. That's all I can say. You think it's good for you? Well, they should rewrite the definition of schizophrenic, because in an act that causes post-traumatic stress syndrome, like going into a war zone that's an act, or into a room and all actors are psychologically assaulting you, is an act of war, an act of genocide, and is a criminal offense. It's called psychological abuse under family violence, as a human rights violation as well. I don't know what else to say, but that's the way it looks. Excuse me. Like I said, CCHR, animal cruelty. A cow needs up to 4 acres of grazing land, and a human needs more than just sitting in a room. Human rights of a prisoner. We don't have enough adequate life and the money to find better housing than we do, and people always say we're on drugs and whatnot. Johnson & Johnson are paying out $70 million and $76 million for Risperidone and Invega side effects of gynecomasculine It doesn't say anything about sterilization and loss of health and time. And they're the biggest payouts in the last 3 years. We have family violence, like I said, by the Canadian government, and lies by police forces and agencies of hostile excessive force takeovers of L'Oreal at Batoche, 1885, Duffy, Medicalcom, type 2 diabetes, and the cause effect of low testosterone and preventing death with testosterone replacement therapy, which I've talked to the psychiatry, which Invega takes your testosterone away, meaning you're killing us quicker, according to this, and causing obesity and diabetic shock and all that kind of stuff. HCG to turn it on, cypionate, propionate, and whatnot. And we look at, like I said, FTM drugs are called testosterone prohibitors, and a testosterone inhibitor makes you into a girl. And all psychiatric drugs that I studied so far, Abilify, Risperidone, Invega, Paraperidone, are all sex change drugs then, and cannot be given to a male because you're killing a male's life. Genocide. You're creating transgenders. It's a chemical war to assault people, and a psychological war of definitions to assault people as well. Like World War II, you think you're going to a safe place with a cross on it, just like they say on the World War II psychiatric things in Germany, and it's not a safe place. You're chemical lobotomizing, sterilizing people, and making up definitions to kill people for no reason. A massive sterilization of inferiors in Germany, a racist discrimination word. Schizophrenic, bipolar, like saying you're poverty, you're a man, that's a woman, women don't want you around. That's why women outnumber us 7-1. Restoring human dignity and human rights to the medical field, meaning what? It's not just to the medical field, it's to the people who are being assaulted by the psychiatry, and that real doctors will heal people, not harm people with a chemical weapon or a bullet. I don't know what else to say, but we got the date there, and it says Friday, June the 9th. Anyhow, thanks for watching if you did. It's a chemical weapon in Invega or any psychiatric drug like it, the chemical compound. You can't call them by the names because they do all the same thing. Sterilization, chemical lobotomy, make you obese, unhappy, and take your life away, and increase your suicide level, your obesity level that causes heart attacks, and die at a quicker rate. It's not natural when it's a medical malpractice, a genocide and a human right violation, and many, many laws violated in our country. Unfair trial. 2 doctors or 5 doctors. There's no judge and jury. People on your side and their side. You have a lawyer, they have a lawyer, and so forth. It's an unfair trial in any hospital system. It's their biased opinion, and they're not really your friends, are they? Unless they back and care about you and love you. They borrow $50, they pay the $50 back. You cannot return it. Recovery is 100%. What you give, you get back. That's recovery. If you lost it, it was a robbery. Thanks for listening. This is Ross Jason Bohmline on Invega Sustenna. Gynomasculine, huge problem of Invega Sustenna or Paraperidone, Abilify, Risperidone, and this massive gut that is going down not much, and it's not muscle, has no strength, you don't feel strong, you have no testosterone, and you feel ill all the time, sleepy, tired, and whatnot. That's right. Other side effect, lack of sleep. Bags under the eyes makes you look old too. There's the bags under the eyes. And hair color change, gray. And that's right. Fat deposits all over the body. No muscle tone. Natural 17-inch arms. Entire life. Huge amounts of fat. Can't enjoy life in your head. Obesity caused by Invega Sustenna, Abilify, Risperidone, Expanane. It's under like 10,000 different names, from pills to one shot a month to one shot every 3 months, just with bigger dosages. It's a chemical lobotomy, sterilization, and a public humiliation of health and fitness and whatnot, and to be able to live a normal life. You just become a zombie and dead-like. I don't recommend anybody to take any psychiatric drug called Abilify, Invega, or Risperidone, or anything like that. If this is the cause and effect, and a doctor doesn't read out, what do you call it? The proper things that it says on Invega Sustenna page. Does your parents have heart problems? Do they have obesity problems? Do they have diabetic problems in your family history? They didn't ask that. You didn't say yes or no. They don't go after your family's records for medical practices due to the fact of it's private or Privacy Act. They can't get that information about your family. You just tell them. It's not written on a piece of paper with your signature date and a lawyer's stamp. They don't have consent to give you a needle. Don't ever take Abilify or Invega Sustenna or any product under it, paraperidone. Look on it. You'll see the Invega Sustenna and the next name, and Google it. You'll see many names around the country and the world. Don't ever take it. This is what it does. Obesity, lack of health, AIDS-like victim. You do not have testosterone afterwards, and it's a sex change drug. Schizophrenia is a word that they say you are a sexual predator. You imagine having sex, and you don't. You only have sex with the woman you love or care about at that time. The doctor and the people who are diagnosing you are mentally retarded and trying to human control your life. Don't take psychiatric drugs from a psychiatrist or anyone else, any type of medication or vaccination, unless you know what it is. If it spades and neuters you, a chemical lobotomizes you, it's killing you like an AIDS victim and making you depressed in life. Suicide rate goes up. When you get fat, as they teach in CPR, your health rate dies because your chances of heart attacks increase tenfold plus. Have a great day. Don't take Abilify or Invega Sustenna.
Welcome to Invega Trinza, paliperidone palmitate, the only treatment that helps control the symptoms of schizophrenia for 3 months with 1 dose. Invega Trinza is only available by prescription. Each dose is given by injection from a healthcare professional 4 times a year. Invega Trinza is designed to be released gradually in the body for 3 months. This ensures that you'll have a continuous amount of medication in your system, but with 1 less daily schizophrenia pill to worry about. Invega Trinza is not for everyone. It can cause serious side effects. Elderly patients with dementia taking Invega Trinza have an increased risk of death or stroke. Invega Trinza is not approved for dementia. Please see the important safety information at the end of this video. You're probably wondering how it works. There are a few steps to follow before you can begin taking Invega Trinza, so let's get started. First, after confirming you can tolerate the medication, your doctor will give you an injection of Invega Sustenna, paliperidone palmitate, followed by a second starting dose about 1 week later. If you're already on Invega Sustenna, starting doses are not necessary. Invega Sustenna, paliperidone palmitate, is used for the treatment of schizophrenia. Invega Sustenna can cause serious side effects, including an increased risk of death in elderly people who are confused, have memory loss, and have lost touch with reality, dementia-related psychosis. Invega Sustenna is not approved for treating dementia-related psychosis. Do not receive Invega Trinza or Invega Sustenna if you are allergic to paliperidone, paliperidone palmitate, risperidone, or any of the ingredients in Invega Trinza or Invega Sustenna. See end of the patient information leaflet in the full prescribing information for a complete list of Invega Trinza and Invega Sustenna ingredients. Invega Sustenna is the same medication as Invega Trinza, but provides 1-month control of your schizophrenia symptoms. Adjustments to the amount of medication you receive can also be made by your doctor to make sure that it's effective and well tolerated. Only after being adequately treated with Invega Sustenna for at least 4 months, you and your doctor can discuss a transition to Invega Trinza. Your doctor can decide whether it's right for you. Only Invega Trinza is designed to be gradually released in your body over 3 months, so you only have to take it 4 times a year. This way, you can feel confident knowing the right amount of medication is in your system each day to give you longer-term schizophrenia symptom control. Think of it this way. Being on a daily pill is similar to a car with a small fuel tank. The car must stop daily to fill up its tank to keep going, in the same way that having to take a pill at the start of each day keeps the amount of medication working in your body. On the other hand, Invega Trinza is like a car with a larger fuel tank. That only has to be refilled once every 3 months. After 3 months, you'll receive your next Invega Trinza dose. This ensures that you'll have a continuous amount of medication in your system, but with 1 less daily schizophrenia pill to remember. The most common side effects of Invega Trinza include injection site reactions, weight gain, headache, upper respiratory tract infections, feeling restlessness or difficulty sitting still, slow movements, tremors, stiffness, and shuffling walk. Tell your healthcare provider if you have any side effect that bothers you or does not go away. Longer-term symptom control with Invega Trinza means you have the chance to focus less on taking your medication and more on setting and working towards your treatment goals, whatever you, your doctor, and treatment team decide they are. Talk to your doctor and treatment team to see if Invega Trinza is right for you. Important safety information for Invega Sustenna and Invega Trinza. Indication: Invega Trinza 3-month paliperidone palmitate is a prescription medicine given by injection every 3 months by a healthcare professional and used to treat schizophrenia. Invega